All right, let's talk about the more serious scenarios. One would be stroke and another is potential heart attack.
Okay, so in these two instances, obviously we know they're very serious, right? But what are we looking out for? A person with a stroke, there's certain symptoms that can be helpful to diagnose. If people have a loss of coordination or balance, if they're losing cognitive function, their speech might be slurred, for instance, they're getting quite dizzy, that obviously can apply to a lot of things, but potentially a stroke as well. Vision problems, sudden vision problems in their eyes, or numbness or weakness in the face, arms or legs, those are signs of a potential stroke, and we've got to act very quickly. So check their face. Has their mouth drooped? That's one indication of a stroke. Arms, can they lift both arms? Is one, they might be able to lift one, but if they can't on the other side, it's again an indication that they might be having a stroke. Is their speech slurred? Do they understand you? And if you're getting yes to or no to any of those things, you're recognizing one of those symptoms, you've got to act very quickly. Time is critical, and call the emergency services straight away. Heart attack, well, that will usually present as, like a vice-like pain or pain in the chest, a gripping kind of sensation. It could be angina, it could be a heart attack, both very serious. Sit them down, call 000. Both instances, stroke or heart attack, sit them down, call 000. Again, if you haven't got signal, do what we said before. Go back to the last point, you had it, or send somebody, stay with that person, send somebody else back to make that call. If in doubt, err on the side of caution. Far better that you have called an ambulance for somebody who turned out that didn't need it, than the other instance that you've misdiagnosed it, didn't think it was so serious, and actually they were having a stroke or a heart attack. So, use the people around you, get help. But if it's clear that they're having a stroke, if it's clear that they might be having a heart attack, you need to call 000 as soon as possible.
And in both cases, really important to know who the first aiders are and to call for the first aid to be on site straight away. What happens when somebody might be in this sort of situation and we're in the middle of nowhere, somewhere on the trail where we might not be able to call an ambulance?
Well, your first aider, hopefully, as I say, is reasonably nearby and can get to them, and they're just going to do their best to stabilise the situation. None of us are doctors. Even doctors don't always know what to do in some of these situations, put on the spot. So again, don't be too hard on yourself. You're just trying to do the best job that you can to help until professional medical help gets there. So the first aider would stay with that person, sit them down. If we're talking about heart attack and stroke, just reassure them as much as possible. If it was heart attack, one of the things that they potentially can do, I'm going a bit off script here, is aspirin is known to help when people are having a heart attack.
Yep. So in terms of heart attack, stroke or any other major injuries, if we were to be in the middle of nowhere, there's no phone reception, we're somewhere in the bush, what would we do in that case?
Well, the first thing you want to do is just get a small team together to help you manage that incident. You want to get a first aider there as fast as you can, the nearest first aider. You don't want 20 people standing around. That's not good for the person who's had the stroke or the heart attack. But you do need just a few capable people to help you, and everyone else continues. Again, you don't want to make this a show, so you want to get people to move away, continue on their way ideally, but make sure you've got the help that you need at hand. And ideally that's the first aider who can come and stabilise the situation, whether it's a stroke or a heart attack, and they'll know some of the next measures to do. You may not have phone reception, so again, it's important that somebody stays with at least one person, ideally a couple of people, stays with the patient, while another person goes backwards or forwards to get phone signal and get help as fast as they can. Then you're just stabilizing that person in that situation until professional medical help comes. Again, we're not doctors, we just need to help as best we can until the real professionals come and take over from us. So, you know, if you've got a few people to help you, it's reassuring when you're acting together as a team, but having 20 people is not helpful. So you just need 2 or 3 people for most to kind of help stabilize a situation. And have somebody else kind of directing the traffic and keeping people moving past the situation. But just get help as fast as you can and stabilise the person until they get there.